few months, you've had to digest a lot of data about COVID-19, but how well do we tell the true cost to the population? A little later, we'll be speaking to Professor Debbie Bradshaw about the subject of excess deaths. But first, let's turn to our next guest, CSIR Researcher Dr. Ridhwaan Suliman, who's made it his mission to interpret data and share his insights on Twitter. Thank goodness he does. He says he wants people to be able to steer clear of misinformation. Dr. Suliman, thanks very much indeed for your time tonight. So, as I understand the concept of excess deaths, it's the number of people who died this year compared to the same period last year. That tells you that there's a pandemic that might be claiming lives when people are not being tested. If you look at those figures, what do they tell us about COVID-19 at the moment?
Good afternoon, Stephen. Indeed, excess deaths is a very important indicator and a critically useful measure to indicate the mortality impact of the pandemic. It allows us to understand the true impact through the loss of life. Of course, while it's critically important and vital to save lives, there are other important measures that we need to track as well. Of course, there's a lot of uncertainty around the virus, and we don't even know what the long-term effects are of those who have been infected by the virus. The excess deaths, whilst they are very useful and critically important, it's important to understand that they don't tell us exactly how much of that excess can be attributed to COVID-19. And a lot more research and analysis and time is needed to understand exactly what can and cannot be attributed to COVID-19.
Okay, I mean, if we look at, and we're relaxing the lockdown restrictions now, and there are lots of other indicators as well, hospital admissions, deaths, which are generally reported. If you look at the numbers, do you see a second peak coming? I mean, some people seem to think this is inevitable.
I think it's much too early to look for a second peak right now. I believe we're still quite in our first wave, even though we've seen the peak of that. All of the data in terms of both the national data and also the data at provincial level indicates a downward trend, and that's a downward trend both in terms of confirmed cases, test positivity rates, hospitalizations, as well as deaths more recently. So we remain cautiously optimistic that we're getting over this first wave. It's too soon to look out for second waves at this point. That being said, there is always a risk of further outbreaks and super spreading events. Hopefully those will be managed in hotspots and possibly at provincial level so that it doesn't become national waves as we go forward.
There's a lot of information that we look at and that you put so simply on your Twitter feed, but one of the things is if we had a second wave, would it move in a different way to the first wave? And I say that because in the first wave, no one's had the disease, so there's no natural immunity. But when the second wave comes, some people would have natural immunity because they've had the disease, even if it was asymptomatic. Does that mean the second wave would actually move more slowly than a first wave?
I think there's still so much that's unknown about this virus that it's really difficult to say at this point. We don't know how long people will remain immune to the virus. Some indications are that sort of wanes off after time. We have seen that the spread of transmission of the virus has varied through the different provinces, and of course that indicates that there'll be outbreaks in different places, and that will spread at different rates as well. I think it's too soon to predict and to know exactly how that will happen and how that will spread throughout the country.
I mean, is there a way of knowing how and when we would know? And I mean, the obvious thing is we would look for the number of people with the disease to start going up. But I imagine there might be other indicators, maybe hospital admissions that we would see as well.
Indeed. I think it's important to continue tracking all of these measures and indicators. The first measure, the easiest one to pick up would be the daily reported COVID-19 infections. And then one would also at the same time look out at hospitalization numbers and keep an eye on the number of deaths. Both reported COVID-19 as well as excess deaths. It's important to keep track of all of these measures, as all of them do have their own limitations, and so looking at all of these measures and tracking them over time will give us an indication of where we're at and indicate as well further outbreaks as they will occur.
If you look at our numbers and the numbers of other countries, of what's happening in other countries, can you see big differences between how the virus has moved through South Africa and how it's moved through other places?
Absolutely. I do believe South Africa has been on its own unique trajectory. It's important to point out that all of the data, as I mentioned, has its own limitations, and this varies between countries. So one can compare absolute numbers, but it's more important to look at the trends in the data. So what we've seen is South Africa has had its own unique trajectory for various reasons. A very early and strict lockdown. We've seen how we've moved through different lockdown levels, and previous easing of restrictions has been while the numbers have been increasing. Interestingly, South Africa's trajectory has followed that of other developing countries, particularly Brazil, Russia, India. But what one needs to understand that data confirmed cases are limited by testing. Testing has its own capacities, priorities, and strategies. Death numbers are subject to perhaps undercounting or different counting measures. So one needs to bear that in mind, and then looking at that and tracking the trends in the data, one can then infer very useful similarities and differences and understand what's going on in other countries as well.